Now this is the session of the quick review of the skull X-ray. Now in this view you will see this is the PA view of the skull. That means rays are passing posterior anteriorly. Why the PA view? If the if the rays are passing in front of your eyes, it will be very awkward position. So this is the PA view of the skull, and in this PA view the paranasal air sinuses are prominent. Now you will see this is the skull cap, and in this skull cap you will see this is the outer table and this is the inner table, and this middle portion is known as the diplo. In this skull you will see, notice this is the orbital cavity which is somewhat hazy in appearance, and through the orbital cavity you will get a triangular prominence. This triangular prominence is the prominence of the petrous part of the temporal bone. Next you will see in this frontal bone, you will see the frontal air sinus. The two sinuses are not equal. It is more or less hazy in color. That means some amount of sinusitis is present in this region. Next, this is the whole thing is the nasal cavity. This vertical portion is the septum of the nose. The first portion of the septum is formed by the perpendicular plate of the ethmoid, and the lower portion is formed by the vomer. And this is the lateral wall of the nose, and in the lateral wall you will see the turbinate or the concha. The inferior nasal concha is the separate piece of bone, and the upper two nasal conchae in the part of the ethmoid bone. So this is the nasal cavity. Now what are the paranasal sinuses you will see here? So you have visualized the frontal air sinus. You will see on the medial wall of the orbit there is some black appearance, and this black appearance structure represents the ethmoidal group of air cells. There are anterior, middle and the posterior group of ethmoidal air cell. All opens into the nasal cavity. Only the this posterior group it enters into the sphenoethmoidal recess. Next, you will see by the side of the nasal cavity there is a big pyramidal shaped black color area, and this is the maxillary air sinus. When you feel your cheek, when you feel your forehead, if you deeply feel, if there is pain, then you will confirm that this is the case of the sinusitis. Next thing you will see, this is the teeth of the upper jaw, this is the palate, the hard palate formed by the palatine process of the maxilla, and you will see here this is the lower jaw formed by the only movable bone of the face. This is the mandible, and this thing you will see, this is the frontozygomatic suture. So this is how you can quickly revise the PA view of the skull. Next view of the skull, I will show you. This is the lateral view of the skull, very important in the examination. In the lateral view you will see the outer part. This is the outer table, this is the inner table of the bone. Here this is the inner table, this is the outer table. This is the external occipital protuberance which you can feel here, and somebody put some here in this region. Oh, there is some rituals. Then you will see here there are paranasal air sinuses. This is the frontal air sinus. You will see only the single view. And you will see this is the orbital cavity. This is the back color, and behind the orbital cavity you will see this black colored area, that is the ethmoidal ear cells. They are superimposed with each other, the anterior, middle and the posterior group. Next, behind these ethmoidal cells and in front of, there is a concave margin you will see. This is known as the pituitary fossa or sella turcica, where the pituitary, the bandmaster of the endocrine orchestra, is situated. Such a small gland regulates whole of the endocrine function of our body. In front of that you will get another sinus, and these two sinuses, they are the sphenoidal ear sinus. Behind the sphenoidal ear sinus, you will locate, you trace the mandible. You will see this is the upper end of the mandible. So this is the region of the temporomandibular joint. And behind the temporomandibular joint, this black color area is the external auditory meatus, which you can place your hand. Behind the external auditory meatus, you will see the mastoid process of the temporal bone, and here the mastoid bone looks like a honeycomb-like appearance. So this is very much perforated with the mastoid ear cells. This type of mastoid is known as the pneumatic mastoid. Now you should notice the big color cavity in front of the mandible, you will see, and above the upper jaw, this is the maxillary ear sinus. It is a very deep sinus, so accumulation of the cold occur in this region and it is very difficult to come out. Next thing you will see, this is the upper jaw, this is the alveolar process of the maxilla, this is the hard palate formed by the maxillary palatine process of the maxilla and behind by the horizontal process of the palatine bone. This is the mouth cavity, this is the lower jaw or mandible, this is the angle of the mandible. Not only that, you will see here, this is the ramus of the mandible, and here you can clearly visualize behind this maxillary air sinus some air-filled cavity is there. This looks very not so deep black, but black in appearance. This is the position of the nasopharynx, and ultimately it goes into the larynx. That means air passes through our voice box. Behind this passage you will see this is the arch of the atlas, which holds our globe of the head. This is the posterior arch of the atlas, this is the anterior arch of the atlas. And you will see this is the second cervical vertebra, this is the odontoid process, this is the spinous process of the second, and this is the intervertebral foramen. So this finishes the X-ray of the skull. Very important for examination and for the detection of any injury.